Good afternoon, everyone.
Hi, Fiona.
Thanks for everyone for coming today. There's a bit to cover, so please bear with me. To start with, a big thank you to our firefighters and first responders for their efforts in the fires that threatened Eagle Bay and Dunsborough. An incredible amount of work and coordination has ensured locals and holiday makers could remain safe. The road to Eagle Bay was reopened this morning, which is great news for people who live there. However, some roads and national parks are still closed and people need to be cautious until the all clear has been given. It's remarkable that it has been brought under control with no loss of life or property. I'd like to thank everyone involved in fighting this fire and commend the community for doing the right thing by heeding the warnings. With regards to our vaccination efforts, I can report that Western Australia has reached 94.4% for first dose for over 12s. 87% for double dose over 12s, and pleasingly 18.1% third doses for over 16s. It's worth reflecting on the fact that Western Australia is on the cusp of reaching a first dose rate for over 12s of 95%. That is a target that many thought we would never reach, even a few weeks ago. And vaccinations are still climbing significantly every single day. Yesterday, 35,894 Western Australians got themselves vaccinated. It's a credit to Western Australians that they continue to roll up in such numbers. As already reported, WA has recorded 2 new local cases of COVID-19 to 8 p.m. last night. Both cases are in quarantine. One is a household contact of the woman who picked up her daughter from the airport after she travelled to Western Australia from Tasmania. The other is a household contact of a person who had tested positive as part of the Hyatt security guard cluster. He was infectious from January 8 and has been in quarantine as a close contact of a positive case since January 11. Only one exposure site has been listed in relation to this case thus far. WA Health has also reported 14 other cases. 3 of these relate to overseas travellers and 11 are interstate travellers. Investigations are underway following the quarantine breach yesterday. Where a COVID-19 positive case, self-quarantining in a city hotel, travelled in a ride-share vehicle a short distance to the Royal Perth testing clinic. WA Health identified that this person should be in self-quarantine and immediately arranged for a St John's dedicated COVID ambulance to return the person to the hotel to continue their self-quarantine. The rideshare driver has also been located and will be tested. The risk to the community is considered to be extremely low, as it is unlikely this case is still infectious. With regards to the mystery case announced yesterday, the person returned a positive test result on Tuesday, January 11, and is believed to have been infectious since January 2. While the woman was infectious, she did not attend work, and contact tracing has identified that she only went to a limited number of sites. Her household contacts have been tested and returned negative results. Investigations are still underway into how the woman possibly acquired the disease. We are awaiting results of genomic sequencing to determine the variant this woman has. However, we are calling on anyone in the city of Coburn who is experiencing cold or flu-like symptoms to come forward and get tested. Please note that there are a number of testing locations available that you can find online. Many clinics are open till 10 p.m. tonight and 10 p.m. tomorrow night. So if you're concerned, please get tested. The past 3 to 4 weeks demonstrate the difficulty in keeping COVID out when it is so widespread and rampant across the rest of Australia. While our test, trace and isolate systems have held up well in the face of both Delta and Omicron outbreaks, aided by Western Australians getting vaccinated and following public health measures. The reality is, unlike the back half of last year, outbreaks seem to be inevitable when there is such a high rate of infection in other jurisdictions. The advantage of our safe transition plan is that it enables us to see what works and what doesn't around the country. We have seen work in other jurisdictions, what we have seen work in other jurisdictions is wide-ranging proof of vaccination requirements. WA has already introduced proof of vaccination requirements at higher risk venues and events, like large licensed venues and music festivals. We have also launched Service WA to make it easier to show proof of vaccination when you are checking in. As of about 1:45 p.m, there had been 221,666 registrations for the Service WA app, which is a great result. As flagged ahead of our Safe Transition Plan, we will be expanding proof of vaccination requirements to a wider range of venues. So today I can announce that effective Monday, January 31, we will be expanding proof of vaccination requirements for visitors to public and private hospitals and aged care facilities, all hospitality venues, including restaurants, cafes, bars, pubs, clubs, taverns, nightclubs and dine-in fast food, roadhouses, service stations and takeaway are exempt. So I'll repeat that. All hospitality venues, including restaurants, cafes, bars, pubs, clubs, taverns, nightclubs and dine-in fast food are included. Roadhouses, service stations and takeaway are exempt. Indoor entertainment venues, including play centres, gaming and gambling, theatres, concert halls, museums, cinemas and live music venues. Bottle shops, the entire Crown Perth complex, major stadiums, gyms, fitness centres and health studios, amusement parks and the zoo, and music festivals and large events with more than 500 people unless exempt. Proof of vaccination will be required at these events and locations for anyone aged 16 and over. And this will not just apply to Perth and Peel, but will apply statewide as of January 31. You can prove your vaccination status by either through the Service WA app or through one of the previous digital or paper-based methods with a form of ID, or through the advantage of Service WA app, though the advantage of the Service WA app is you don't need to have your ID with you. So just to repeat, you can prove your vaccination status either through the Service WA app or through one of the previous digital or paper-based methods with a form of ID. Community sport and school-based events at less of one of the specific venues listed are exempt from the proof of vaccination requirement. The date of January 31, which is ahead of our planned safe transition, aligns with the second dose cut-off date for Group 2 workforces as part of the mandatory COVID-19 vaccination policy. It also gives venues and businesses more than 2 weeks to adjust. Following WA's safe transition, we want the public to be confident in these public settings and that they're only mixing with other vaccinated people. People less likely to be carrying or able to pass on the disease. It reduces the risks posed by unvaccinated people, bringing the virus into busy populated settings. Life will become very difficult for the unvaccinated from January 31. No pubs, no bottle shops, no gym, no yoga classes, no gigs, no dance floors, no hospital or aged care visits. If you go and get vaccinated today, you can have your second dose by early February. But if you choose to remain unvaccinated, and at this point, it certainly is your choice, you're choosing to put yourself at risk, you're choosing to put the people around you at risk, and you're choosing to increase the burden on our health staff. We have seen what works in other jurisdictions. These will be the broadest proof of vaccination requirements in the nation, and they will not be removed anytime soon. We've seen the disaster in New South Wales when they removed proof of vaccination requirements in mid-December. We've learnt from their mistakes and are determined not to repeat them. We'll also be making changes to our hotel quarantine system ahead of the safe transition, effective immediately. Travellers that are double vaccinated record negative PCR PCR results from tests on days 1 and 6 of hotel quarantine will be able to leave hotel quarantine from day 8 if they have a suitable premises to isolate at. They will be able to complete the final 7 days of their quarantine at a suitable premise using the G2G Now app. They will also be required to undertake a PCR test on days 9 and 12. And if their day 12 test comes back negative, they can exit quarantine at the end of day 14. As an added security measure, any members of the household, where the person is conducting their quarantine, will also be required to self-quarantine, use the G2G Now app, and undertake a PCR test on the travellers day 12. All tests will be undertaken by WA Health using mobile testing at self-quarantine premises. This will be a more effective way of managing the burden on our hotel quarantine system going forward, especially until the Commonwealth's quarantine facility is finished. The threat of Omicron is real. With such a heavy load going into our hotel quarantine system from interstate travel, it's important we move people out safely. These changes are based on expert health advice considering people become positive with Omicron earlier than with other strains. Our health advice is clear that this adjustment is safe and will reduce the risk of Omicron spreading in hotel facilities as we can ensure safer room allocations are in place. In closing, a final call out, and this is very important. Right now, if you're experiencing any symptoms, cold or flu symptoms like coughs, sore throats, a runny nose and the like, please come forward and get tested right away. We don't want to risk any more cases in the community. And unlike the rest of the nation, we have testing supplies with low wait times. Do not let what you've seen elsewhere put you off coming forward to get tested. It's the best thing you can do to minimise the risk to yourself, your family and your community right now. Thank you. Are there any questions?
Premier, these proof of vaccination rules, you said they won't be removed anytime soon. Are we talking months, years? What are we looking at?
Oh, well, I'd expect this to be going for years. COVID has been around now for 2 years. It's showing no signs of slowing down over East, no signs of slowing down around the world. I expect these requirements will be in place for years to come.
Is there any plan with your hotels, quarantine hotels, to turn them into, say, hospital wards like we've seen over on the East Coast?
No, we don't have any plans to do that. We basically have hotel quarantine. I think we're pretty much the last place that has it. But the system is very, very full because we have anyone who comes in from another state, despite our hard border, pretty much goes into hotel quarantine. And so this is causing a lot of stress and strain on the system. So that's why we're changing the rules around hotel quarantine, but we have no plans to turn them into hospitals.
What is our extreme risk with every other state and jurisdiction? So how come there's still so many people coming from other states?
Well, because there's exemptions. Commonwealth officials, Defence Force officers, people who do essential things like fix equipment in hospitals or in the community that no one else can fix. There are certain exemptions that come in, and there's of course some compassionate cases. So there's numbers of these people. There's truck drivers. There's all sorts of people who we have to have come in. So that's why there are a number of people still coming through.
When we open up on the combination of like international still coming, and the fact that every single state and territory is extreme risk means everyone who comes from there is having to go into hotel quarantine. Is that why we're in a situation we haven't been in before?
Well, anyone coming in internationally and anyone coming in interstate goes into hotel quarantine. So it's putting a lot of stress on the system. So we have 265 people within the cap from overseas each week because that's the agreement, and the Australians returning home. Then there's people above the cap. They may well be specialist doctors, nurses, other medical staff that we need to run our health system. They can come in above the cap. They go into hotel quarantine. They come in from overseas. And then there's people exempted from interstate who I just outlined to you.
For about 3 weeks from February 5, that's not long. What would you say to business about how that's going to look February 5? To give an example, they seem to be blind to what close contact will mean in an office environment. I mean, we know what the Prime Minister's saying about close contact in a house environment, but what will it look like to businesses from your point of view, without their own sort of protocols being put over that, but from your point of view, if you go to work and someone around you's got COVID, what do you do?
So all of the protocols around all of these things, the definition of close contact and the like, are being worked through at a national cabinet level. So we'll define them in the lead up to the Safe Transition Day, which is February 5. We'll define them in the lead up to that point. What we found, I think the Commonwealth has changed, or the Commonwealth and other states pretty much have changed the date, or changed the protocols on at least 2 or 3 occasions now. So they're constantly evolving over there based upon their experience. And so we're going to watch and see in the lead up to our date so that we can get the protocols as right as they can be based upon their experience. So it's still being worked through. We haven't finalised them at this point in time.
How much notice will you give to businesses in West Australia as what those protocols will be?
Well, certainly as much notice as we can, but nothing's perfect with COVID. You've seen that over the last 2 years. Nothing's perfect. Things change, things move. So we'll refine all those things in the lead up to February 5.
Will you open February 5? Will you open February 5, Premier?
Yeah, as I've said repeatedly, the plan is to open on February 5.
The plan is, but are you going to open on February 5?
I've answered your question.
The Health Minister said on the radio yesterday that potentially there could be square metre limits and capacity limits when we do open on February 5. How strict might they be?
Look, as I said, we'll refine those as well in the lead up to February 5. Bear in mind, I've just announced a whole range of changes to rules around unvaccinated people, a whole range of changes to hotel quarantine arrangements. Things move quickly, and we have to work through all these things constantly, as we have over the course of the last 2 years. The rules around public health social measures we'll refine and announce in the lead up to February 5. But they change, the measures you put in place change upon the rates of infection. So when you first introduce them, it may well be that rates of infection are low and rates of infection then climb. And so therefore the public health social measures, which are mask wearing and capacity limits, all those sorts of things, potentially get tougher as time goes by based upon circumstance. So we'll announce what they'll be. Hopefully we'll give a bit of guidance and a roadmap as to where they'll go to. What we found watching over east, particularly New South Wales, is they've moved them around pretty arbitrarily. They remove them and then they reimpose them. We're going to try to provide a bit more of a roadmap and try and avoid some of that, but my expectation is they'll be tougher here than elsewhere.
The trigger point for extreme risk when it was announced was 500, an average of 500 new community cases per day. The Northern Territory moved to extreme risk at 12:01 this morning when it was announced the 7-day average was 440. I know it seems like a sticking point, but it takes away compassionate exemptions for people who want to get in. What was the working around bringing that in early?
The reason was when you saw what happened with Queensland, when we put in place a border and a case came in 1 hour before the border went up, and then the same with Tasmania the other day. We put in place a border and the infected person came in just before the border went up. We brought it forward in order to reduce risk.
In the rules for unvaccinated people from the 31st, you mentioned that takeaway is exempt. Did you mean that in the sense that people can take food and leave, or can unvaccinated people, say, sit down and dine in a McDonald's?
They can't sit down and dine, they can get takeaway. So, putting in place rules to stop people getting a coffee or getting some Chinese takeaway, we thought would be a bit difficult. Now, we considered it, but certainly people sitting down and mixing in a restaurant or a cafe or a bar won't be permitted, but people getting takeaway, and many people pretty much live on takeaway, is something we thought was a fair compromise.
Just back on the definition of close contact and certainty for businesses, from what you've seen so far interstate, how much do you expect WA's definition will differ from the national definition?
I don't think it will differ hugely, because you've got to strike the balance. You've got to reduce the spread of the virus, but you also have to make sure that hospitals and schools and transport and logistics and service stations and power stations continue to function. So that balance has been worked through based upon the experience over east. And so the luxury of what we've done is we can watch and adopt the rules that best suit the circumstances we face. So that's why waiting was a wise thing to do.
Can we expect 14 days to be wound back?
I'm sorry?
Can we expect 14 days of isolation to be
Well,
wound back?
it will largely reflect what the rules are at that point in time on February 5 that are in place over East.
Requiring the requiring the household contacts of interstate travellers to self-quarantine is a new announcement when they're released from hotels. Are you concerned that that will cause worker shortages in Western Australia?
No, because the numbers are so low. The numbers are so low. Well, how many people have got in our hotel quarantine at the moment? On any given day, it's 1,000 or so. So the numbers are so low. Over East, they're getting 40,000 cases a day. We have about 1,000 people in hotel quarantine. So the numbers are very low. We're changing the rules because the pressure on the system is so great at this point in time. But we're confident the rules that we're moving to are safer than trying to jam more people into hotels where you could have spread to security guards and to other people in the hotels. So we're doing the best we can in the circumstances we face.
Just to clarify, someone could walk into a McDonald's, order at the counter if they're unvaccinated, but they have to take the food and leave, or do they have
Takeaways.
to go to the drive-through?
Sorry. You can get takeaways. That's the rule we've landed on, but you can't go into a restaurant and have a meal. You can't go and sit in a cafe, have a meal. You can't go into a bar, have a drink, and sit in a bar and have a drink. You can't go into a pub, sit and have a drink and a meal. You can't go to an amusement park. You can't go to the zoo, museums, multiple places. So it's going to be, for the unvaccinated, life as unvaccinated people currently experience it is going to change significantly. And this is for two reasons. One is to protect everyone, because the unvaccinated transmit far more easily than the vaccinated. And it's also to encourage the unvaccinated to get vaccinated. We've found that the rate of vaccination has continued to climb. So we're at around 95% of over 12-year-olds, which must be close to a world record. So over 16s, which is the measure they use over East, you can probably add 1% or 2 onto that. Now, a whole bunch of people, commentators, media, Eastern States, media commentators said we'd never even get to 90. Said we wouldn't get to 80. But we put in place things that worked. So mandates have worked. These measures work. And I know a lot of unvaccinated people don't like it, but we're trying to save their lives, and we're trying to save other people's lives. And we're trying to reduce the pressure on the health system, because by being vaccinated, you are far less likely to go to hospital and far less likely to go into intensive care. And we know the more people that go into hospital with Omicron, the more pressure it puts on the system. So if you have a look at Victoria and New South Wales today, their hospitals are under extreme pressure, and their intensive care units under extreme pressure because unvaccinated people are filling them. So these are measures we have to put in place to protect the community, protect vaccinated people, protect vulnerable people, and protect the unvaccinated from themselves.
Some people have waited to get vaccinated, looking at the Novavax as a possible vaccine that they'd like to take. Any update on when that will come in? Oh,
it's a matter for the Commonwealth. The vaccines are out there. A lot of people who said they'd get vaccinated, they wouldn't have AstraZeneca, said they'd only get vaccinated when Pfizer came along, and then they said they only get vaccinated when Moderna came along, and the same people are now saying they only get vaccinated when Novavax comes along. So look, the vaccines are great, they're safe. I've had both AstraZeneca and Pfizer, all of you have as well. Please, just go and get vaccinated.
Allowing takeaway food, but not takeaway beers, is that purely just an incentive for the unvaccinated?
Look, it's a big incentive. If you want to go to a bottle shop, get vaccinated.
Rapid antigen tests become free for concession card holders on January 24, as announced by National Cabinet.
I'm sorry, I missed the start of your question.
Rapid antigen tests become free to concession card holders from January 24. Are you confident that in Western Australia those tests will be available at pharmacies and supermarkets on that date?
Well, I don't have those exact details. I assume they're ordering them. They're lawful. So I assume supermarkets and pharmacies are ordering them as we speak and trying to get supplies in. So, look, it's an issue, having enough rapid antigen tests. It's an issue all over Australia. In fact, I think it's an issue all over the world.
More teachers union is saying that they are worried about that, because that's going to be one way that they can assure sort of the supply of teachers into the community come February 5. Will the government sort of oversee making sure that schools? and
Yeah,
stuff like that?
it's a balance. There's a lot of talk about rapid antigen tests. So by February 5, we expect we'll have 8.5 million tests available to the government in Western Australia. But you can churn through them very quickly. And nationally, they're going through them very, very quickly. So you got to make sure you only use them as required. You don't just use them willy-nilly. Now, that's the balance. So we're watching what happens over East. The rules around rapid antigen tests will be based upon the best practice of it, based upon the experience of what happens over East.
Can you guarantee that we won't experience the shortages and the chaos really that they are over East in terms of rapid antigen tests? People just can't find them.
Well, we'll do our best. We'll do our best. Everyone's trying to get them. So we've got huge orders on for rapid antigen tests. Other states do as well. Other countries do as well. I don't think we manufacture them in Australia, so we have to buy them from overseas. So there's a lot of pressure in terms of acquiring enough rapid antigen tests. But as I said, we've got $8.5 million we expect to have by February 5, and many millions more after that. And then you have the private supply as well, that pharmacies and supermarkets have on order as well. So we're doing our best there, but as I've said to you the other day, nothing is perfect with COVID. There will be issues, there will be problems. People will acquire it. We're doing our best to make sure that we are as prepared as possible. The most important thing people can do is prepare themselves, and that is get vaccinated, and if you're eligible, get your third dose.
Have you seen any Omicron modelling yet, preliminary or otherwise?
We're reviewing that. Obviously, that will be an ongoing discussion.
When can
So
we
it has
expect
been.
it?
Sorry.
It'll be an ongoing discussion.
But you do have that modelling now.
No. There's discussion going on around these things.
Have you had any response from the Prime Minister regarding your letter around getting a share of rats, the national rats?
I raised that at National Cabinet today. The health advisor he had there, she advised me that Western Australia would get our share of the national stockpile late January, early February. So, but that's only about 1.1 million. So I would expect that they would arrive late January, early February. That was the assurance I was given today.
Just with the mystery case, have you had any preliminary indications on what strain that might be?
No, it's they're doing the genomic testing as we speak.
But they know what strain it was already.
No, they're doing that. They have to do testing on it. I don't have that advice at this point.
What we're seeing on the East Coast in terms of cases soaring, supermarkets empty, their workforce is under strain. Do you think that is a preview? I mean, you haven't seen the modelling, but is it a bit of a preview of what is to come for WA?
Well, I think we're already seeing some shortages of some goods because a lot of goods have to come from the east, and they've a lot of truck drivers have gone off because they've been close contacts or positive for COVID. So I just urge people, when you go to the supermarket, when you go to the shops, just be reasonable. Don't try and hoard. There's more than enough, but where the problem comes is when people hoard, and that makes it difficult for others. So just urge people to be reasonable. After February 5, after that point in time, obviously the same sentiment would be in place, which is we just ask people just to do the right thing by everyone else in the community. Don't go in and fill up trolley fulls of groceries, because all you do is make it more difficult for everyone else.
We've heard a number of times that WA will benefit from watching and learning from the experience of other states. We've been watching and learning for some time now. Is there anything from their experience so far that can lead to, are there any concrete lessons that have already been taken from that experience?
There's
so
lots.
far?
There's
Any
lots.
specifics you can tell us about?
Well, the most important is get to high levels of vaccination. So what you saw with New South Wales in particular, when they had their first outbreak, or their big outbreak that rolled on and then infected Victoria and New Zealand and us actually, and Queensland, that was back, I think it was about June 20 of last year. They had low levels of vaccination, so it was very problematic, and lots of people have died around Australia as a consequence. The higher you get to your levels of vaccination, the lower the death rate and the lower the intensive care unit admission. So I think that's probably the biggest lesson. The other thing, of course, is we'll watch the protocols, because they've chopped and changed on protocols around close contacts. We'll watch and make sure that hopefully we get the close contact protocols right, so that we don't have lots of people in crucial industries leaving the workforce. So they've had many thousands of people not able to work in hospitals because of the close contact rules, and they have to constantly change the close contact rules. But you don't want to make them too relaxed, because then you enhance the spread of the virus. So those sorts of things are the sorts of balances you need to reach based upon watching what they do over east. I think the other thing is, and New South Wales did this. They went, they went from tough rules to no rules, back to tough rules, and I think what that showed was you need to have proper public health social measures in place from the beginning, and you need to be prepared to step them up. So that's things like mask wearing and capacity limits and all those sorts of things. So I think the lesson from New South Wales, and there's a lot you can learn from watching New South Wales, is those sorts of things that I just said will make a big difference.
Harshest rules in the country, do you expect some of the unvaccinated people to want to leave WA?
I couldn't understand the start of your question.
Said harshest rules in the country soon, do you expect some of the unvaccinated to leave WA?
Oh, I wouldn't have thought so. I mean, the easiest solution is just go and get vaccinated. Now, most people have. A lot of people were negative and so forth, but as I said to you, first dose, over 12, we're touching 95%, or 94, 95%. So over 16s, and if you think about it, over 18s, we're approaching nearly 100%. It's very, very high. So the sort of hardcore of unvaxxed will still be the major group of people who occupy intensive care beds, but they're only a tiny proportion of the population. But they will have, their life won't be the same as it was. So I just urge them to go and get vaccinated. They get very angry, very cross, they march around down at Elizabeth Quay and so forth. I think what they find is if they just get vaccinated, they go back to work, they can go to the pub, they can go to the football, they can go on holidays. Life will be sweet, and after all that, they'll probably say they were never an anti-vaxxer.
How important is it for you to
Can we
get the
your
third
opinion
jab?
on whether, speaking of anti-vaxxers, can we get your opinion on whether Novak Djokovic should be put?
I will leave the Novak Djokovic matter to the Commonwealth Government. That's a matter for them. It's an imbroglio.
How important is it for you, though, and obviously the people around you, in terms of the third jab? Because we see and we keep being told that third jab, that booster, is important in relation to Omicron. I mean, the levels of that will be nowhere near sort of 90% come February 5. So how important is it to get that number up?
It's very important. It grows every day. Most of the people going and getting vaccinated are third doses. So we're at 18% now. It's growing very, very rapidly. And I think now that people have had the first two doses, most people sort of are pretty relaxed about getting a third dose. Certainly I was. So I just say to people, go and get your third dose.
Do you have a view on percentage on that one? In terms of before, being certain about how open we become on February 5?
Look, I just think it makes things easier and reduces hospitalisation if we get third doses up, and I just urge people to go and get it as soon as they are eligible. And to be fair, I think there's a lot of lines and a lot of people at the clinics. I just urge people, if you're at the clinics, if you're at hospitals, if you're in retail, please be respectful of the staff. I'm getting reports of people behaving badly in hospitals when they're asked to wear a mask, or people being unhappy they're in a line somewhere, or in retail, being a bit rude. So I just urge people just to be kind.
We've previously been told.
I'm sorry, I have to get a glass of water.
What are the sort of projections around how many people will have had that third dose?
I don't have that, I'm sorry.
Was there any sort of advice coming from the Chief Health Officer? If we are saying that's the best protection you can have against Omicron, has there been any kind of revised health advice as to why the show is happy to open up on February 5, regardless of what that number is?
These are matters of discussion within government, and we'll continue to discuss them.
Premier, we've previously been told about preparations that were underway for the hospital system based on the Delta variant when that was around. How have these changed or been increased now that Omicron is around?
Well, Omicron, Delta is more lethal, but Omicron spreads far more quickly, so you get larger case numbers at a single point in time. So that's the difference. But look, our hospital bed numbers are growing rapidly. Our staffing is growing rapidly. We are, over the course of sort of 18 months or so, we're basically adding the equivalent of a new major public hospital into the system in terms of beds. So we're doing as much as we can to prepare the hospital system for what's ahead.
Has
The
it changed since
ICU bed count is still only 121, and then we've got 38 new beds that might be coming in the next few months. I mean, has that been moving quick enough for you?
We're bringing on additional. Sorry, I'll let you finish. We're bringing on many additional ICU beds, and we have a major surge capacity as well.
The new hotel rules, you said that some of those were based on waiting for that Commonwealth shared facility to be open. Any latest on when that might be open?
I think it's June or July was the latest advice I received. So it was originally March, then it moved to May. I think it's June or July. It's obviously down to 500 beds now. It was going to be 1,000 beds, but our role is to staff it. So we're working through how we'll staff it, but we need exact advice from the Commonwealth as to when they expect it to be finished, so that we can have the staffing arrangements in place on the correct day. Because what we don't want to do is have a bunch of people sitting around doing nothing because it's not ready. So we're seeking that advice from the Commonwealth currently.
These proof of vaccination announcements today are for 2 doses. Do you have any prediction if it will be included, a 3rd dose will be included at some point in the future like it was with the jobs?
So our expectation is that in order to be fully vaccinated, the Commonwealth rules will say 3 doses. And once that happens, we will move to the 3-dose rule in due course. So we'll give some time for that, but that's what will happen. So as you know, we've mandated for the workforce 3 doses. The Commonwealth rules we expect will say full vaccination is 3 doses, and at some point in time we'll move to make sure that for all these venues and places it's a 3-dose requirement.
What do you say to those people who want to include retail shops, the hairdresser? Will you push it further or not?
Well, it's pretty broad at the moment, and but there's certain essential things. So, you know, you've got to be able to buy groceries, you've got to be able to buy clothes. For many people, a haircut is important. And so all I'd say, yeah, well, that's right. I didn't want to discriminate, but it's important. So all I'd say is it's pretty broad at the moment. If you have a look at the list, bottle shops, pubs, bars, cafes, restaurants, amusement parks, the casino, and it's applying all over the state. So you got to remember, before it wasn't applying in regional WA outside of the Peel, so it's now all over Western Australia. And as I said, you know, the unvaxxed people won't like it much, but it's another incentive to go and get vaccinated. And I guarantee, once you're vaccinated, life goes back to normal, and they'll wonder what all the fuss was about.
What do you have to say to those people who are really afraid of the border opening? Who are really afraid?
Look, we run the risk of the virus coming in now. I mean, we have people coming in from overseas. We have huge pressure on our hospital quarantine system every day. We have people coming in who are in the tiny group of people coming into Western Australia into hotel quarantine who are positive every single day. So, as I've said to you constantly, my fear is we won't even make it to February 5. So we're doing our best to make it to February 5 and have as normal a Christmas holiday period as we can, grow our numbers of hospital beds, get more RAT tests in place, make sure that we get far more people fully vaccinated and far more 3rd doses and far more 5 to 11s vaccinated as we can in the lead up to that date.
You mentioned
to
earlier
yourself and the Health Minister from the ANF with concerns about not being prepared, EDs potentially becoming super spreader events, no clear plans for COVID positive pregnant women. Are those concerns all valid? Or how do you, I suppose, respond to those kind of allegations?
No, I haven't seen the letter, but you know, this is not unusual that we get letters from organisations like that constantly raise issues, probably to get media attention. So all I'd say is we are preparing the hospital system as best we can, and we have the luxury of watching what happens over East to make sure we get the protocols as right as we can.
Just to clarify, an unvaccinated person could use a drive-through at a takeaway service, but not a drive-through at a bottle shop.
Correct.
Premier, you mentioned earlier that with regard to modelling based on the Omicron variant, that discussions were ongoing. just to clarify, are they discussions based on modelling that you have already, or are you
No,
yet to receive any modelling?
we're analysing all the information that comes to hand. Obviously today we're making some very, very major announcements. We'll continue to analyse all the information that comes to hand so that in future we'll make further announcements as time goes by.
But some modelling has been presented.
And we're working through the issues.
It was really hot up in the Pilbara today, about 50 degrees Celsius in Roebourne. The prison there for a long time doesn't have air conditioning. They're quite overcrowded there. The OICS is always constantly bringing this up as an issue with the way that WA up north is warming up. Do air conditioners need to be brought into that prison sort of as a human rights issue?
Look, I have been to Roebourne Prison. I was unaware there was no cooling. I assume they're trying to put in place measures as we speak to keep the population there as cool as possible. That's pretty obscene temperatures, 50 degrees plus. That's really hard. So I just urge everyone up there to do what they can to keep cool. I'm sure they're probably putting in place more traditional measures to try and keep people cool in the prison, but it's probably pretty rough up there at the moment. Thanks very much.
Thank you.